This video will focus on the importance and the benefits of skin-to-skin care. Skin-to-skin care is often referred to as kangaroo care due to how these marsupials carry their young. Skin-to-skin care is when the infant is naked or clothed only in a diaper and then placed or held on the caregiver's bare chest. Skin-to-skin care is widely used within the perinatal setting and has been practiced in BC for decades. It is an effective way to support the infant's physiologic transition to extrauterine life. Skin-to-skin care provides numerous benefits to both the caregivers and their infants. Being knowledgeable on this practice is essential as it is a part of a nurse's role to promote and support attachment and empower the dyad. Psychological maternal benefits include an increased self-confidence, competence, and self-esteem, the enhancement of mother-infant bonding and attachment. Skin-to-skin care decreases the risks of maternal anxiety and postpartum depression, as it positively affects the maternal mood. Skin-to-skin contact also reduces stress that is associated with the NICU stays. Physiological benefits include an increase in breast milk supply, and skin-to-skin contact stimulates the letdown reflex. Skin-to-skin contact stimulates the vagus nerve, which increases endorphins, achieving an analgesic effect. The vagus nerve excitation results in a sedative effect as well. This can alleviate pain and make procedures such as episiotomy and laceration suturing less painful. Skin-to-skin contact stimulates the release of oxytocin, which in turn promotes placental expulsion, can decrease blood pressure, and can decrease the risk of postpartum hemorrhage as it aids in involution by causing contraction of the uterus. The psychological benefits for the infant include decreased levels of stress, the enhancement of bonding with the infant's parents. Skin-to-skin contact also promotes feelings of safety and regulates the infant's emotional state so that they are able to properly enter REM sleep, and gut function and motility can be active as the newborn is not in a state of distress. Skin-to-skin contact can also act as a non-pharmacological analgesic for the infant as it does for the mother. This helps infants cope with pain. For this reason, infants should be skin-to-skin during procedures such as vitamin K injections or blood dot screening. There are many physiologic benefits for the infant in regard to skin-to-skin care, such as the colonization of the gut microbiome. Infants who receive regular skin-to-skin contact tend to gain weight faster as they experience less caloric expenditure. This practice aids in the neurodevelopment of the infant, with effects both short-term and long-term, as it accelerates maturation and increases the complexity in brain development. Skin-to-skin contact offers physiologic stability to the infant in numerous ways, such as thermoregulation, cardiovascular regulation, blood glucose regulation, and the stabilization of breathing and increased oxygenation levels. The World Health Organization, Health Canada, and Perinatal Services BC all recommend that the newborn is to be placed skin-to-skin directly after birth once the infant is thoroughly dried and should remain in skin-to-skin contact for at least 1 hour. Additionally, it is recommended that newborns receive their physical assessment, eye, and umbilical cord care while remaining in skin-to-skin contact with their mother. Barriers to achieving proper skin-to-skin care include cesarean section delivery, infant admission to the NICU, breaking skin-to-skin contact unnecessarily for medical assessment and/or routine intervention, and lastly, lack of care team education on the importance of skin-to-skin contact. In applying this knowledge to nursing practice, we can utilize this information to promote comfort and decrease procedural pain for both mother and infant by promoting skin-to-skin contact during intervention. We can offer patient education on skin-to-skin contact and encourage its continuation even after discharge. We can advocate for immediate and uninterrupted skin-to-skin contact following all types of birth, unless it is medically unsafe to do so. Doing this respects and protects the golden hour following birth. Lastly, if a procedure or intervention is not medically necessary to the immediate well-being of the mother or the infant, it can be delayed or done while mother and babe remain in skin-to-skin contact. It is important to take a family-centered approach to care and not forget the father or partner in the discussion surrounding skin-to-skin care. Research has shown that skin-to-skin contact is beneficial for both the father and the infant in many ways. It can increase bonding and the paternal involvement in infant care. Performing skin-to-skin care can aid in the transition to fatherhood. Additionally, skin-to-skin contact with both parents further strengthens the infant's gut microbiome, which helps to kickstart the infant's immune system. Ultimately, the bottom line is that skin-to-skin care is one of the most effective and simple ways of supporting physiologic transition, and it bolsters numerous benefits for the entire family unit. Skin-to-skin care should be advocated for and respected from the moment of birth and onward.